Thank you very much. It's such a great honor and pleasure for me to be speaking in front of not only the whole distinguished audience here, but also the co-chairman of this session, who are really pillars and stalwarts, and not only in echocardiography in India, but also in cardiology. Both have been the previous presidents of the Indian American Association of Echocardiography as well as the Cardiological Society of India. So it's really honor to be speaking in front of me. And I think both of them have visited us in Birmingham many years ago, a long time ago. And I think Dr. Chopra had done some work on assessment of tricuspid regurgitation by echocardiography many years ago, which hasn't been still challenged. His work is still very distinctive and very original. Many of the things that we do after many years, they get superseded by something new, but his work still remains very original. So really great pleasure. Well, I'm going to talk on artificial intelligence in echocardiography. And if you look at the echocardiography is an irreplaceable tool in cardiology. You cannot really replace it. It's also most cost effective and most widely used modality, but it's also time consuming and subject to human error with significant inter and intra-observed variability, and sometimes we are unable to assess certain disease entities. The limitations of manual echo assessment, for example, of LVF, volumes, and global longitudinal strain is really poor quality images, patients on end ventilation, inability to move patient non-cooperation. There is also a lot of subjectivity involved in LV endocardial border delineation, because many times you don't see the border completely and you really have to fudge a little bit there. And also in patients with arrhythmia, you have beat to beat variation in LV size and LV shape. And we also have physician basis. We look at the previous echo and say, well, it showed 40% ejection fraction, maybe it's about the same now. So that's one of the problems. So artificial intelligence has come in, and I think before we go into artificial intelligence, we need to remember a few terms. We just wrote a paper published in the Echocardiography Journal this year only, just a few months ago, a review paper on artificial intelligence in echocardiography, and also discussing some of its limitations. So what is artificial intelligence? It is the science and engineering of creating intelligent devices which are really basically clever computer programs that do the tasks very similar to what the humans do, but also beyond human intellect. Now, that's the important thing, goes beyond the human intellect, and it can improve. These artificial intelligence computer can repeatedly improve themselves based on the data provided. So that's the definition. A few other terms one needs to remember is one is a machine learning. Machine learning is actually an artificial intelligence-based computational program able to receive and learn from data sets, solve problems, and uncover hidden relationships using algorithms. So there are 2 or 3 types of these. Mainly it's 4 types. Supervised, where actually you label the echo images, and the model analyzes data, accurately recognizes patterns, predicts disease progression. Now that's important, and also identifies risk factors. Unsupervised, you give no instructions are given to the computer, and computer uses own data sets. And then there is semi-supervised with a combination of the two, and 4th one, reinforcement learning, which we really don't use in cardiology, so won't go into that. So it's basically supervised, unsupervised. So here is an example. Now this Dr. Caracas used to be a fellow with me, and his wife is an artist, so she drew these pictures above there. And you can see, for example, here we have hypertrophic cardiomyopathy, Fabry disease, amyloidosis. So this is supervised learning program. You are labeling everything. You are labeling right ventricle, you are labeling left ventricle, you are labeling the ventricular septum, and then the computer will pick up this, what you see on the left side, and call it that is amyloidosis. So this is very easy for the computer to do. And now this is more difficult. This is unsupervised. And here you give the series of these short axis views. You can see them of the ventricle, and you'll pick up those which have similarities. For example, if you see group 1, they are very similar. Group 2 is not exactly similar if you look at group 2, but certain features are common, so computer will put those as a cluster. So group 2 cluster, and there's a group 3 cluster. So this is unsupervised, where you tell the computer nothing, but it will pick up things which have similarities. So that is unsupervised learning. Now, there is one other model which we even more frequently use, and let me see if I can get into the next one here better. It is called deep learning, and what it is, it's a deep connect. It is actually a network of connected units, similar to the neuronal system of the human brain. Just like we have the neurons in the brain, it's very similar to that. And so that is the deep learning. And in that, there is one called convolutional neural network, which is very similar. This is a deep learning technique useful for analyzing visual output. So you give something to the computer to look at, visual output, and the connection pattern similar to the arrangement of neurons in the human brain, the visual cortex. And if it effectively recognizes patterns, learns directly from data, eliminates need for manual feature extraction. This is the most commonly used, this convolutional neural network, or CNN, is most commonly used in medical image analysis. So it is something like this. So you have input there on one side, then you output, and you can see these connections. These are something like the connections in the neurons in the human brain. And you can have more layers. If more complicated, ones will have more layers. This is just one layer. There can be different layers. So just to give you this as sort of an example, supervised, unsupervised, and then this deep learning. So those are the major three terms that one needs to remember when you do this. Now, the black box is something very interesting. It is a complex deep learning system that can be viewed through its inputs and outputs, but its internal mechanisms are hidden and not really understood by the observer. For example, the artificial intelligence can look at subcutaneous fat and then come up and say, I can make looking at subcutaneous fat, nothing to do with the heart, can make the diagnosis of hypertrophic cardiomyopathy, amyloidosis. How he does it, we do not know. We don't understand that, but they do it. And how valid it is, sometimes very valid, sometimes not very valid. Or they can look at the retinal images and predict what cardiovascular risk factors you have. So this is going beyond human intellect, and that's called the black box. But the problem with the black box is many times we do not understand how the computer arrived at that particular conclusion. So that is a big problem with the artificial intelligence. This is a painting from Picasso. It's a painting of a violin, but there is no violin there, right? Only bits and pieces of violin. Some little grapes are there also. So this is actually painting of, so what it does, now when it comes to a black box, it will put all this together and show you a violin. But if you have never seen a violin, you will never recognize it, right? So that is that's some way to one other way to understand what is a black box pattern. For example, this analogy of the black box nature of artificial intelligence using Pablo Picasso's painting, Violin and Grapes. Actually, there is no violin in this painting. It was just some pieces. No one can say this here is a violin by pointing to precise area. This, on the other hand, is a violin painting if you put it all together. So this analogy can be extended to the use of deep learning in echocardiography. Assume that deep learning interprets the image of LVH and concludes that the cause is amyloidosis. If you ask the machine why the diagnosis is amyloidosis and request it to show the specific region where the amyloidosis decision came from, it is unable to do so. So this is where the problem comes up with artificial intelligence and how we are going to use it in the future. If you don't understand how it is done, I think it's not going to be that reliable. Well, what about at the same time, artificial intelligence is very, very useful in echocardiography. It has been used a lot now, and I think is the future, and we are going to be using a lot of it in the very near future. For example, right here, this is where it has been used. It's been used for echocardiography training for novices. So when the person puts a probe on the chest wall, it will tell you, move it to the right, angle it 10 degrees, angle it 20 degrees, and you will get a long axis of the left ventricle. So this is where the artificial intelligence becomes used. You don't have to stand there and tell them, no, move this way, move ourselves. Sometimes we don't even know how we move it, but we just get the long axis. We automatically get the long axis. But here, the artificial intelligence will tell you what to do. So that's very, very useful. It has also been useful for images interpretation, like I showed you, amyloidosis, classification of aortic stenosis, mitral regurgitation severity assessment, diagnosis of things like sarcoidosis, arrhythmogenic right ventricular dysplasia, etiology determination of LVH, post-operative RV failure, assessment of failure with preserved ejection fraction, and also very important mortality projection from echocardiographic images. The artificial intelligence will look at echocardiographic images and tell you the chances of this patient dying in 10 years is 30% or so. So it gives you that also information. Again, that's a black box type of prediction. And these are some of the studies that I've taken from the literature. The authors are on the left side, tells you the type of machine learning. Most of them are supervised or semi-supervised, like I showed you before. And the aims of the study, I think I went over it quite a bit on this side. And the value added by AI is increased accuracy for non-experts, time saving for experts and non-experts both, simple, time saved and accurate assessment, more accurate evaluation than conventional 2D and TE, just not only time saving, but accurate prediction. Better classification, for example, of severity of aortic stenosis with significant potential to optimize the timing of aortic valve replacement, and precise recognition of the pattern of LV responses, and also as aortic stenosis progresses. So these are all the, here again, some more here, improved diagnostic power of transthoracic echo with potential to reach CMR in the future. For example, here you can look at the mitral valve annulus and actually differentiate, just looking at the mitral valve annulus, you can differentiate patients whether they have cardiac sarcoidosis or not. Completely unrelated, but it'll tell you, that's where the artificial intelligence comes in. And here detection of cardiac amyloidosis without the need for human interpretation. So that's where I think we are going into the future here. Here is what actually is done on quite a few machines, looking at LV ejection fractions, LV volumes, and like you can see on the left, it can predict, give you stroke volume. It can also tell you whether there is any need for resynchronization therapy, whether septum and posterior wall are contracting together or they are not dysynchronized and not contracting together. How many of you use this in echocardiography? Use this? Well, I don't use it very much because if I see the patients have got poor window, I don't look at this at all because this artificial intelligence is not going to help me. If the window is good, then I think I find it very reliable. But at the same time, it is something we are going to be using a lot in the future here. Same thing goes for global longitudinal strain. Won't go very much on that. And very recently, paper just came in, I think this month. They looked at 870 patients with COVID-19. I looked at LVF and LV global strain by using the deep learning technique, one of the deep convolutional techniques, from a company called Ultramix or some sort of a program, AI program. And what they found was that compared to manual expert analysis on the echocardiogram, the AI had minimized variability, the variability was minimum, and also because of that, there was increased statistical power to predict mortality. So that's where we are going now in echo, looking at echo images and telling the patient or giving an idea of mortality and predicting for risk factors. So artificial intelligence in echo not only analyzes the images but also predicts mortality. By unraveling hidden findings, machine learning may have an important contribution to the evaluation of rare diseases. So it looks at segments. For example, if you're having a long exhibit, first look at the RV wall, then ventricular septum, then look at the posterior wall. So it segments things and then actually tries to decide what is actually going on. Now, there are some limitations, and one of the limitations is epistemological concerns. I thought this was something very important. So I asked one of my former fellows to go and study epistemology. It's part of philosophy actually. And he did that. Not only he became very expert that, he got a degree in that also in Turkey. So he is now an expert in epistemology. He studied so hard and looked at so many things. So there is no study in echocardiography that discusses artificial intelligence inadequacy and lack of understanding. So here is one thing that he did. And what he did was he went into the history and found that epistemology is actually a branch of philosophy that explores the nature of knowledge in relation to the human mind. And the two individuals, they are all German philosophers, very, very prominent. One was Immanuel Kant and other is George Hegel. And actually, Immanuel Kant is dubbed by many as the early forefather of artificial intelligence because some of his philosophical work forms the basis of artificial intelligence. So he's one of the early forefathers, Immanuel Kant here. So basically, what they're saying is they're discussing the limits of the human mind in evaluating real world structures and causations, and that poses a major challenge to the use and accuracy of artificial intelligence. Let me show you an example here, what happens here. Again, it says that artificial intelligence, according to Hegel, cannot form a synthesis. It can only establish, it'll take another 40 seconds, or can only establish a tangle of relationship. There is only data and relationships, but it really cannot form actual synthesis here at all. And this is what is the basis of epistemology. And again, the diagram made by his wife, who is an artist. For example, if you are looking at a real world image, you are looking at the properties of object, color, tardiness, hardness, odor, etc. You get a first distortion because the properties are coming to the mind only through the use of five senses. There are more senses, only five senses. And then you get a second distortion because the human mind is looking at only schemas that it has. It really goes into the schemas. So there are two types of distortion. So whatever we are perceiving it is, I'm looking at an object here, it really is not the real object, it's what our mind is perceiving. So that is what they think is a bigger problem with artificial intelligence. It perceives what it perceives an object, but that may not really be the real object. So that is the basis of, and that may be a big limitation of artificial intelligence. So in conclusion, what we think is what is the real intelligence? Is artificial intelligence plus human intelligence. So the human intelligence cannot be ignored. It has come to that. Now, if you remember, last one thing I want to mention, if you think in terms of whether the humans will be replaced by artificial intelligence, think of something, you give the artificial intelligence a problem to solve. It wants to solve a problem. The artificial looks at everything and finds out that there is solution based here, and part of that is done by the humans. Now it wants to solve the problem by itself. So what it will do? It should eliminate the humans, right? So that is a danger in the future, that the artificial intelligence may grow to such an extent that it may just eliminate the human beings because it's coming in the way. You told them to solve a problem, humans are coming in the way, so they will actually try to eliminate the human being. So with this, I will leave you here, but to show you that despite all the inadequacies of artificial intelligence, we are going to be using it a lot. But when it comes to predicting something we don't understand how it's done, I think those will have to be validated in the future. And we'll have to see how exactly, because sometimes you tell the artificial intelligence to think of a country where the first letter and last letter are the same, and it'll make a mistake. It'll write down as Chad. Chad is a country in Africa, CHAD. Now C is different from D, but the artificial intelligence come up and say these are the two letters are same. So we have some inadequacies also. Thank you very much for kind attention, and thank you for giving me another minute or so. Thank you.